Well, I was looking back on my unit here at Skype to see the last time we'd done it this way. I think it was July, Mr. Ashford, our last virtual chat, and here we go again. Anyway, thank you for spending the time this Sunday. I put a request out for some questions and we had lots of response. So I know your time's precious, so we'll do what we can today, but hopefully we can do this on a regular basis again, yeah?
Yeah, we certainly can, Paul. You know me, I'm happy to answer questions and happy to be available.
Okay, I need to ask my question one more time. I wasn't getting where I was trying to get yesterday, and I promise you I wasn't trying to roll anybody. My point about timings, if this one is the bigger variant, therefore the capture time can be quicker, and I think that's the point I was trying to make. You know, you were all saying before it's 15 minutes to be under the scrutiny of being checked up on, wasn't it? Is that right? And now this one could be quicker. So has the time changed?
The science with the new variant suggests that the time hasn't changed. So although it's got increased transmittability, the transmissibility still works on the same principles. So basically, what it says, that means is if you are within 2 meters of someone for 15 minutes or more, you have a higher chance of catching it than you did with the old variant. It doesn't mean that if you're with someone for 2 minutes, it's more likely you'll get it. That science just isn't there with the new variant at the moment. As the Director of Public Health, I think, said at the press conference yesterday, that might change as scientists view the new variant more, but certainly at the moment, those principles, the 15 minutes, the 2 meters apart, and the other things that go around that haven't changed.
But we should be much more cautious. I think that's the wording, isn't it? You know, treat everyone, as they say in the UK, as if they've got it almost.
I think we should be cautious regardless of the variant, to be perfectly honest. As the Director of Public Health again has explained, it doesn't change our reaction. The Isle of Man is going down the route of an elimination strategy. So unlike a lot of large jurisdictions that can't completely suppress the virus, that we are not trying to sort of minimise case numbers where it would be very important to know the variant. We are actually saying we don't want any case numbers.
Okay. Now, we're not just doing health. Questions have been building up in my inbox all week about other things, and I appreciate if you can't answer them, that's fine. But I should point out, you always say don't need to pre-tell me the questions, just fire them away. So here we go.
Yeah, just fire them away, and if I can answer, I can answer. If I can't, I can't.
This is really more Alf Cannon, I guess, but you know, why a self-employed flooring contractor can't work on a totally empty property in his own, and the nearest property to him is 500 yards away, when office workers can go to work, I'm not sure that's quite right, and sit at a desk 2 meters apart, breathing in the same air-conditioned air and offering only £200 a week. Your thoughts on that?
Well, the first thing to say is that office workers should only be going into the office if necessary. The prohibition on movements means that anyone who can work from home should work from home and must work from home. In relation to contractors, I know that's frustrating, and it may be reviewed after the 3 weeks if we need to extend the 3 weeks for any reason. But the reason, like the first lockdown, is it's not just about saying we don't want people mixing. It's also about ensuring that we limit movement as well. Because people even being out and driving around, etc., there is a risk there.
And another question of finance. So this is to do with hairdressers. You know, they're saying people that work there can get money, but they can't for paying their landlord. Is that something that will be looked at again, do you think?
Well, in terms of people who are self-employed, they themselves are able to claim MIRA at the moment as well. The MIRA scheme and the way it works was actually changed towards the end of the previous lockdown, where Treasury allowed self-employed to be able to claim MIRA. So the individuals can claim that as well, as even although they're self-employed. There's no government grants for businesses, obviously, this time. Like I say, it's supposed to be a 3-week circuit breaker lockdown. If it has to be extended, then obviously, as the commitment's already been made by the Treasury Minister, all the packages will be looked at again.
Okay, Everly, border testing was introduced on the 23rd of December. Had this policy been implemented before the main Christmas travel period, is it reasonable to expect that the identified cluster would have been identified and closely monitored, as demonstrated with a number of day one tests now returning positive results?
It's impossible to say. Day one testing is only expected to pick up 7% of cases. Now, obviously, with the prevalence that's there in the UK at the moment, that will be why we're getting so many day one tests, because basically it's rapidly increased in the UK, as we've seen in the daily figures, and also the ONS estimates as to how many people are now infected there. So that's the reason why the day one is now appearing to be so effective. In relation to the day 13 test, which is probably the more crucial one in these particular cases. Again, it's an unknown, because it may well be that with the two particular cases that they may well have passed the day 13 test, because as again has been pointed out by the Director of Public Health on previous occasions, there is still that residue risk of 1% that go past day 13 before they actually present.
You dismissed the calls for border testing to be implemented and advised that the 14-day isolation period for travellers was the gold standard in protecting the island from the virus. Why did the government not heed the advice of Dr. Glover, the island's leading scientific expert on such matters, to introduce border testing to avoid such a situation?
The 14 days is still a gold standard, and like I say, there is no evidence that having the test in place earlier would have actually avoided this situation, because those two cases may well have been part of that 1% that go past the day 14. In fact, we're actually, it's surprising it's taken this long for one to emerge. We've always known about that 1% risk, and day 13 testing does not remove that 1% risk.
You indicated in conversations on the press conferences, I think, that the 111 call service was being overwhelmed by concerned members of the public who may have been visiting places initially identified as low-risk venues. Why did the department fail to use the time the island had available as COVID-free to create a digital track and trace system that would have quickly identified those who may have been come into contact with any of the venues visited by the infected cases? Could we not have asked our world-leading e-gaming community to assist the government in developing a similar app-based track and trace solution to the NHS, or requested permissions from the NHS to use their app locally, which is already available to all other residents in the various app stores?
Well, interestingly, Paul, and you'll remember this, it goes back to a conversation we had during the last time we were in lockdown around apps and the effectiveness of it. In order for an app to be effective, you need about 60 to 70% of the population to be using it. The only app that actually came close to that, or the two apps that came close to that, was Singapore or Ireland. But in relation to the Ireland one, what's interesting is you not only had to download the app, you had to activate it as well. And if you look at the activation numbers, it was way off the 60% of the population. Apps potentially don't work. The NHS app, I'll be perfectly blunt myself, I don't feel it is working correctly in England. I don't think it has managed to control the outbreak. And in fact, what we're seeing in the UK, I would suggest, says that the app hasn't had a fundamental effect in limiting the virus. Physical contact tracing is much more effective, because you have someone sat down talking to the person and finding out where they've been. There's nothing to say that the people in that venue, that most of them would have been using an app anyway, even if it existed.
And you have no desires that we could have, because I think Jersey went with one, didn't they?
Jersey did, but it's gone very silent about it now. And again, I'm not potentially certain it has actually limited their outbreak in any way.
And you see a lot of places, they have these QR codes just to identify they've been in there. Is that all part of that app structure? Is it?
It is. Initially, they tried with people actually just putting in the venue, but then they have the QR codes to scan. But again, there's mixed evidence over how that's working, because, of course, it requires the person to scan the QR code. And if people don't scan them, they don't know they've been there.
This one's a little left field. Given the current extremely low infection rate in the Isle of Man, in brackets relative to the UK, and if the vaccine rollout in the UK in supply was limited, would the Isle of Man consider deferring or returning some of the vaccine supplies in order to reduce the total number of deaths across the NHS system in the UK and the Isle of Man combined?
Well, obviously, if we've done what we need to do, then we wouldn't require any further vaccine. But it depends. Like we say, we need to see which way this goes with the virus, whether it's one of those things where you're vaccinated once and that gives you protection, permanent protection, or whether it's something that's a constant thing, a bit like the flu jab. We don't have the science on that yet, but obviously we will only take the supplies of vaccine that we require in order to protect the island.
Should we talk about that quickly? A third one that's being rolled out now, is that going to make another big difference to us here?
Yeah, the Moderna vaccine, which is what you're referring to, Paul, that has now got access from the UK. In terms of that, it's a very a bit like Pfizer. It's very logistically pragmatic. It doesn't have to be kept as cold as the Pfizer one does. Pfizer is -70, but the Moderna is -20. So there is logistical challenges around that. The UK orders are a bit lower on that as well, so we don't get as high a share. we will get a share of the Moderna. But I'll go into more detail on that on the press conference tomorrow on Monday. I'm coming back on to give you bore you all stiff with vaccines again tomorrow.
Yeah, we've missed you. Why have you been away for 2 days?
So in relation to yesterday, I had other meetings. And not yesterday, the day before yesterday, I lose track of the days now. On Friday, I had other meetings, which, as the Chief Minister said, I was away on other business. And yesterday, because it was an announcement of a particular type of case, it was best to have the Director of Public Health there, and also education related, the Minister for Education. So there's nothing suspicious about it. You're stuck with me again tomorrow.
I'm looking forward to it. I can't wait. I'm going to have to shorten this one. It's a massive long letter, but basically this person works in the motor trade business, in dealerships, and he's noticed that there apparently there's about 90% of the people in the motor trade are still opening for essential purposes. And of course, that's the thing. He would expect it to be around 25% if it's what should be deemed. Is it tricky to know what is essential and what isn't?
It can be, but the regulations are quite clear in the fact that essential in terms of that is it doesn't mean the showrooms or anything else. It means repairs to cars. They are able to operate a click and collect service, the garages as well. But they shouldn't be just going about things as if it's day-to-day business. And
how do you police that, or don't you? I mean, is it just left to...
No, we have the enforcement team exactly the same as we had last time, and the enforcement team is out and about. And people can report things if they think that something isn't going correctly.
Because I don't hear about a gardener. We had this last time, didn't we? Can a gardener do their own work when they're obviously working by themselves in the middle of a large garden?
Yeah, it goes back to the first question, basically, Paul, where we had about the painter and decorator. At the moment, the point of the lockdown is not just to limit interactions, it's also to limit movement. So at the moment, the answer is no. But if we have to extend past the 3 weeks, then all decisions will obviously be reviewed.